Good day, everybody. Welcome to Dental Voice Season 2 with Zyris. My name is Rolando Mia, and we have a wonderful special guest. Before we get to that, Dental Voice is about hearing from clinicians, specifically the experiences that they're having, understanding things that they're experiencing, and also getting advice, real-life advice about what they're dealing with and how they're overcoming that. Today, we have someone, oh my goodness, Dr. Kelly Tanner. So I'm going to have to read this because anytime I meet somebody who has an incredible body of knowledge, information, and also experience, it's awesome because you get to really understand not just what people think, but things that they know. Dr. Kelly studied at Old Dominion. She is also a PhD, a doctor, got her PhD at Regents. She's a former associate professor at Thomas Nelson Community College. She's also the former coordinator of the SACSCOC accreditation there, adjunct professor at Old Dominion University, professional education at Phillips, holy cow, and then also an owner of Kelly Tanner Leadership and Next Level Dental Hygiene Leadership. So I'm excited. I'm looking forward to really hearing your perspective. So many things are going on today, and it's that. So with that, good morning, Dr. Kelly Tanner. Welcome.
Good morning. Thank you so much for having me. It's such an honor.
So I want to jump right in, and I want to kind of so far when you consider everything that's going on, dentistry, everything that we're doing here, unprecedented with COVID. What are kind of, based on everything that you've seen, based on the people you've spoken with, what are some of the observations you're seeing about this as it relates to the dental office, the team, and then the hygiene team?
Yeah, thank you. Great question, because obviously COVID has affected all of us and will continue to do so. So it's not just about dealing with the now, it's about how we look ahead in this and try to determine what really our supply chain looks like, some of the obstacles that we're going to come up against, and opportunities also. And, I think that all of us can say, of course, this has been a difficult time and in many layers of our life, but what I have found is there's been a lot of good that's come out of it as well. Any big disruptor in anything gives us opportunity to change and grow, just like with leadership, just like with, think about the first car, think about technology, think about, anything. We have gotten so accustomed to being, we have to be in person, we must do things like this, and slotted in, utilizing different formats and different styles now is a great opportunity for us. So I say, let's look at the other side of the opportunity and see what these disruptions really offer us.
So I love the context. You're right. Disruption forces us to have to get out of our normal, right? Or our routine. And because of that, all of a sudden, we're out of our comfort zone and we're having to do with a lot. We're hearing so much in the dental practices. They're having to change. If you were to, based on everything that we've seen, the biggest issue right now is the change that everyone in the dental practices are having to deal with. PPE, processes, engagement. What are some of the thoughts around change that you could share with us for people going through that and how they interact with each other?
Yeah, that's a great question, because there's been a lot of that. Of course, emerging back into the workforce, there was a lot of anxiety. And we didn't know what was going to happen, I guess what you would call it, the fallout, the transmission rate would be, even knowing what we knew at that time, what it was going to be like until we did it, until we actualized that into where we are now. And so I think now we're comfortable in our zone, but now there's still opportunity for growth. And where we're seeing still the opportunity with this disruption is the communication in the offices, and how that transparency between all of those team members can really help strengthen that team. But you have to be open and vulnerable to really say and ask for what you need. And then also the team, as it relates to the dental hygienists and the assistants, all of them are leaders in their practice. They're looking to the doctor for, what are we doing now? What are we doing to overcome this obstacle that could be an opportunity? How do we get masks? How do we get the plastic containers? What does this look like when we can't get the wipes that pull out of the canister that are on back order infinitely in perpetuity? I mean, what are we doing? And it's an opportunity for that practice manager to really explain, to say, here's what our plan is. And to say part of it is also that we don't know. And that honesty, it's kind of like I said in one of my videos, when you're at the airport and your flight's been delayed, right? You're always looking at the big board to say, okay, when is my flight going to be? What's the new flight departure? What's the new flight departure? What's the new flight departure? And then as soon as it comes up, you can get on with life. But until that time, you're just hanging in limbo. So I think the better the communication, the better the questions, and the ability for that practice leader, for that dentist owner, or even the hygienist who is leading their team, can answer those questions to really get to the why and what the anxiety is about, to then fold it back into, okay, here's our plan. Here's our plan for now. It may change next week, but here's our plan for now, and this is why.
See, I love the context around that. Open communications, candor, directness. Now, here's the thing, though. I'm hearing a lot, and love to get your perspective, that in a dental practice, the dental, she, he, they are in charge. No one else is. How do you overcome I'm going to call it the perception or the stigma of that, and then, get the courage, I'm going to use that word, to be able to go up to your to your dentist and say, hey, I need to talk to you. What are some of the things that would help people do that? Because people are struggling with that right now, and we've heard some people that haven't even come in because of that. Thoughts?
Yes, and I think this kind of folds into one of my favorite topics. I'll try not to go too far in a rabbit hole, but courageous followership. And we hear a lot about leadership, but we don't hear a lot about followership. So in a practice, we have traditionally thought of the dentist as the leader, the owner. This is going back 25 years ago from when I grew up in this industry, 27, maybe 30. I know it's weird. It's like, I don't want to do math. Math will hurt you. But math will kill you, just so you know. So going back that far, you're thinking of the dentist as that leader, and you're going to them saying, okay, what are we doing? What are we doing? And then sometimes it's just like, okay, if I'm not being heard, then it shuts off that line of communication. So those followers give power to that leader, though. And unless they bring up that opportunity for conversation, the leader never knows what is really going on. But really, you can't be a leader without followers. So it's a symbiotic relationship where those followers, which are the rest of the dental staff, have to ask questions. We have to engage in that dialogue. It's a responsibility that we have to the office, to our patients, and for our profession.
I like that. It also makes me think a leader needs followers, but something I also took out of what you were saying, which is, wow, is to be a leader, you also have to be able to follow. And I think that's something that I don't know a lot of people would fully embrace. Do you agree?
I agree. And one of the reasons why these dentists or, whoever is hiring these litany of professionals who work with them is because they're talented folks. And so one of the opportunities I see with the offices I work with is stepping back and saying, here's our challenge. Let's get together and let's hear all ideas of, here's what we're up against. Here's our challenge. Where is our opportunity? What types of ideas do you have? Here's what we've thought about. Here's what we've done in the past. And here's what we're going to try. Talk to me. So that input of that followership, and some people may be more of the bystander, but maybe they're the glue of the group that holds it together, who can come in and offer some suggestions. But I think the we-ness starts there, because it's about the we in the practice, and the patients feel that. They feel the we, the W-E, the we, not we.
Sorry.
No, it's like the we, the us. It's about the usness, the togetherness, putting it together. I know you are. Rolando Mia. I know you're messing with me.
No, the context is huge, and I love the context, the message behind that, because when it's amazing when people become stressed, as we are now, the anxiety of COVID, the anxiety of it's here with us forever. All of a sudden, it makes you, even more, give me something to hang on to, which is what I know. But all of a sudden, we all don't know. So, what advice, or how would you talk to, or what would you tell people who are stuck in the I have no idea?
Well, I think you have to ask for help. And that's a part of why people follow you, because you tell the truth. You're a truth teller. And I think that's important for both sides of it. Just an example to use from just this last week. Of course, all of us are facing in dentistry what happens in September and October with the appointment slots that are open. And so we got everyone together, our team, and said, here's what we've come up with. Here's our angles that we're trying. Just know that we want everyone to remain employed. And then so we took it out to our hygiene teams. Here's what we have. Shoot holes in it. Like, let us know where we are wrong. What are we not seeing? What do you recommend? And to really keep that open dialogue, it's the openness of a leader and that ability and that room for that leader to allow that follower or that employee to step into that space to be able to connect and come up with that solution.
Yeah, I could see that, because right now I would venture guess virtually nobody knows what's going on. So the more the better, and the more dialogue the better. I think too, and as you were talking, it makes you think, as a dentist, or even the lead, whatever in the practice, you can't do it by yourself. So reach out, ask for help, and then I guess be open, which is pretty cool, right?
Yes, and so it's really figuring out what the anxiety is. If a person's kind of retracted from a group, if you can tell something's wrong, the
Hmm.
practice owner, whoever is, interacting with that individual, it may be the assistant, it may be the doctor, whoever has the closest relationship, to go to them. It's just like in any other relationship. Hey, I sense that something's distracting you. I sense that
No, I'm
there's
fine.
no, no, I'm fine. No, I'm good. Why would you say that? Well, because you're not talking to your patients at all. And you sense that stress. So give them an opportunity to talk about the stressors in their life, what obstacles they are facing personally, because we all have these. Well, I don't know, in Virginia where I am, and the locality that I'm in, we're all doing the 9-week homeschooling sessions. And so it's like, is everybody on? Are we good? I mean, there's a lot of that going on at home for folks who are having to struggle with all that. So it's all the little things that add up to the big things that affect patient care, that they need to know that their doctors and their team care enough about them to notice, to say something seems off. How can I help you?
That's pretty cool. It's funny. Talk about off when this whole COVID crisis hit, in virtually every forum, dentistry, hygiene was, the message was basically, if you do this, you're done. You're going to get it. You're going to get that. And we're finding that that's not happening. What are some of the things that you've been seeing with regard to the hygienists out there who are still feeling maybe apprehensive, or anxiety, or fear even, of going back to work because of that? Because, I mean, it's still around.
It is. And I think there's a lot of opportunity there to understand too what the anxiety is really about. Is it about that they think they're going to contract it? Because there's a lot that we can do by isolating the areas, by putting in all the proper PPEs, the protocols. And then also it disrupts their flow of care if they have to do something different, because now you're having to rinse with the stuff and then ask different questions and make sure that they've got this form filled out and the temperature. So it's all these little disruptions that people were not used to, or, and they didn't have to really account for in their care. But what a lot of offices are doing, the offices that I coach do and consult with, is they've actually lengthened those appointment times, and they've implemented an assistant so they can take care of same day care. While the patient's already there, the operatory is already there. If there's active infection, to be able to do that and then have the tools that you need, such as, to isolate the areas, like with Isolite or Isovac, or, other ones that use, of course, y'all's products are the Cadillac of everything. And then also getting them comfortable with that training to say, here's how you use it. Here's how you work it into your workflow, because that also could create anxiety. I don't know when I'm going to use this thing, so to be chairside with someone who can, whether it's a representative or I'm not sure of your structure, but I'm a consultant and I'm a dental hygiene coach. So I'm coming into the operatory. How about at this time, if you try doing this? What about if you stop right there? And then it's usually, yeah, I can do that. That actually makes sense that I can do it. So talk them through their processes and have it be their idea based on their processes.
The whole piece of education is huge, because we're hearing that sometimes new technology, new systems are basically given to the teams and said, hey, you got to do this. And then they're kind of left to their own devices. So the message about take the time to educate, take the time to understand, I think is huge. Do you feel that there is a kind of an overload, let me call it a fatigue that teams are facing? Because coming back, you mentioned it, all of a sudden there's a different screening that they have to deal with. There's a different process they have to deal with. They have to clean differently. They have to put on all this extra stuff. They have to change a lot of practices have been operating for years, 10, 15, 20 years. And all of a sudden now it's changing. Do you think that change fatigue is causing some of this? And, thoughts on how to kind of get around that?
It's a real thing. And it's not just the dental practice is changing. It's all the external environments that are changing that you have to keep up with and manage and try to figure out that you're bringing into work. And I think really what the hygienists do that I work with is they say, Kelly, I am running behind because of this. Could I have a 20-minute gap here where the assistant is doing something else? Or, we troubleshoot it. It's a conversation of, tell me what you need. That's always, tell me what you need. Tell me what you're feeling. We'll work through it. We always do. If you need 20 minutes to catch up with your notes, if you need to be staggered, if you need to come in 20 minutes late, because the hygiene care system that you have set up to do a lot of same day care will take care of the rest for the production in the office to make sure that it's covering 3 times the hygienist salary, because that's what a lot of the practice providers are thinking about. But if you're taking care of your people, they'll take care of you. But the change fatigue is big. And I think that, and I don't know about you, Rolando, but I know that I felt it, and I'm not even in the clinical operatory every single day. It's just coming out of it's kind of like a cocoon of COVID and saying, okay, here's all the things I have to adapt to that have been disrupted, but that's really an opportunity for growth. And I think it has strengthened a lot of teams, because you know what our teams say is, I never realized how much this practice cared about me.
Wow. That's, when you can get to that, talk about making you feel, I never realized how much this practice cared about me. And unfortunately, they're the ones who I don't think this practice gives a rat's ass about me. What do you do with that?
I think that some of the decisions aren't being communicated, and there's usually a lack of communication. It's just like any relationship, when you feel like because if you don't understand why the decisions are being made, you build resentment. And it's got to be that radical candor of being able to have that conversation of, hey, it's the same thing in a marriage or a relationship with your child. If you don't have that conversation on the front end, you're going to feel it at some point. So it's better to just talk about it and be transparent to say, listen, this is what I'm up against. How do I overcome this? And what do I have to support me? I hear that every day. Kelly, this isn't working. I'm not able to do this. I've got it. I'll remote in. I'll do whatever I need to do. But taking care of your team and for them to feel like that they are cared for is really going to be, it gets them past those little humps in the day where they feel like they're so, they feel like they can't overcome it. They can't. And it's that you can do it. We've got this attitude that you're building in the background for them and with them.
I love that. Thank you for that. I really appreciate it. It's getting the courage to just be honest, be genuine, and express that. And I believe too that a lot of times the dentists feel the pressure that everything is sitting on them. So they're like, leave me alone, when in fact they also need to reach out. So it's that's pretty cool. Love the message. Let me ask you this. Infection control, it's because COVID is real and it's not going to go anywhere. And very recently, it's becoming pretty much before it was speculation that it was airborne, but I've been hearing from a bunch of our guests here. One is an oral surgeon. He's also NMD. It's airborne. Dr. Resnick was explaining that.
Mhm.
The Michelle Strange, she's spent a huge amount of time in looking at it, and infection control protocols, all that. Aerosols are a big issue. The issue of using the Cavitron, and I'd love to get your perspective on this. Initially, guidance was, you got to do hand scaling, no more Cavitron, no more ultrasonic instruments, nothing like that, polishing even, because it's going to spread it all over the place. But people are using them. What are your thoughts on, that and kind of the care or not that it may or may not provide?
Yeah, this is a topic of conversation, and I'm sure that it's like it's the tipping point, right? I think the person's got to make the personal decision for themselves of what they're going to do. Okay, so I graduated from hygiene school from Old Dominion University in 1996, and at that time we were taught to only hand scale and only use that ultrasonic if you really needed to. So I thought I was a wuss if I used an ultrasonic scaler. I'm just telling you. Okay, so I'm just like, well, I have to use it. Then I thought I was a wuss. So then growing up and, evolving and learning about how it disrupts the biofilm and how much more effective it is with the lavage and the disinfection, all of these things, there are people who say, if you're not utilizing it, you're doing substandard care. But if you are, it puts them at risk. So, I mean, I am of the belief, and this is my opinion. Okay. This is my opinion based on evidence and what we know about COVID right now today, and then what we have for the isolation, disinfection. I say use your Cavitron, when you need it for active infection. If it's a localized area, you use it for a localized area. If you're doing a scaling and root planning, do not put that off. That infection is in the body. It's an oral systemic link, and it's even more important now because of the inflammatory process it's provoking within the body with COVID. So it makes them more susceptible for it. So I think we need to use it where it's indicated. Use your Isolite, use your Isovac, use your other systems that you're using, and then your HEPA filters. I think that you're huge. I mean, we make sure that they're in all the operatories where Cavitrons are being used, and protect yourself. Use like you did like you learned in hygiene school. Wear your gowns, wear all your garb that you were supposed to be doing anyway. So protect, use what you know, do what you know to do, what's effective for the patient. And it's fine. It's science. We've got it.
I love it. It's science. We've got it. Right
it's
on.
Science, all right? I mean, if you're taking all the aerosols out, one, you're protecting yourself. Two, the next patient, you've disinfected the oral cavity with the hydrogen peroxide rinse. Where are we missing this?
Right.
So I don't know where the miss is, but again, there's a question mark. I don't know. We don't know yet.
And what's the good news, though, is the fact that when you look at the number of COVID cases, dentistry is not the super spreader of it. And it's really good to hear that in our industry, you're not seeing massive cases coming out of dentistry right now. So, yeah, it definitely is working, I'm going to say.
I feel safer at work than I do anywhere. I mean, other than my own home, I really do, because of all the protocols we have in place. That's one of the safest places to be, in my opinion.
That's cool. That's so cool. So you teach, you're a professor, your experience with young, or not even young, people, let's just call it that, who are looking to enter into hygiene. And then all of a sudden this thing called COVID comes in, and all you hear about is how, oh yeah, you do that, you're going to get infected, you're going to die, or something crazy, your head's going to explode. What advice or what feedback would you give people who are considering entering into the profession of hygiene, but then all of a sudden are kind of being, hit with all of this information? What would you tell them based on everything, as a person who wants to be a hygienist?
Dental hygiene is one of the best professions in this world. I love it. You can make such a difference in this profession at so many different levels in the 7 roles of a dental hygienist. You can show up and do your clinical work. And if that's all you want to do at the end of the day, you can do that. But the opportunity to learn, grow, impact at different levels and change people's lives is still that opportunity every day as well. Just like HIV. we did not know hepatitis B. We didn't know we didn't know. And we're going to learn more about it. And every day we get closer to an answer. So I say, follow your dream. The rest will take care of itself. You are protected in the meantime. And, you're going to come out on the better side of this. And it gives you an opportunity to be a change agent, a change leader in your industry, because you have been through that experience.
Oh, I love that. A change agent, a change leader. We're going to get it right on.
We've got this. Science, man. Science.
Science. So had you always wanted to be a hygienist, or you have passion, you have energy? Did you want to do something else?
Oh gosh, ever since I was 17, and I was a sterilization assistant in the office, and I had a really close relationship with my hygienist. And I remember the first time I looked in the patient's mouth, I was like, "Can I assist you to do the probing?" And I'm like, "You have to see blood." Of course you don't call it blood in the operatory. Red, it's red. That's back when you use the minimizing words, right? And then I realized that it really fit what I wanted to achieve. I knew I had a purpose. I knew that I was a servant. I knew I had gifts to serve. And it seemed like there was a huge amount of opportunity. And so, yes, the dental industry, maybe I would go back and be an orthodontist. I don't know, because they have pretty cool job, with changing people's overall everything. But dentistry is where it's at.
And then what's awesome too is you practicing professional hygienist, and then you decided to go ahead and get your PhD. What was your thesis, or your I can't think of the word.
The dissertation.
Dissertation. That's it. When you got your doctorate.
It's a long title, but basically it was looking at what dental hygienists felt like they wanted to develop leadership, like what they thought that was important to them in all the different 7 roles of a dental hygienist. So I looked at, it was a composite study, and it was rank ordered. So everybody in each group looked at, I said, okay, what do you think the most important leadership skills are? Okay. They are, communication, this is for all the educators, and then the clinicians, and then the researchers answer this. Okay. Now, how do we go about developing those? And then they rank ordered, and then I brought them all together, and I said, okay, what are the number one, the top 5 rank order that you feel like that hygienists need to be leaders? Because we have such an understudied area of leadership in dental hygiene. You look at nursing, and they have books, and even dentistry. I think it's valuable for us, because leadership, just as it sit alone, it weaves into all areas of our life. And the number one thing that all hygienists said that we need to learn, communication. So it's about listening. It's about being a courageous follower. Also, there are ways to go into offices to offer DISC assessments of how people are communicating. It's like a profile assessment of how you fall into which category, and then how you communicate the hot spots that you're like, oh, that's why they tick me off when they say it like that, because I'm this letter and they're that letter. But then it also translates into how they're able to talk to their patients. Because usually once you take this assessment, you can say, oh, I know Rolando's an S. He's an S all day long. What do I know about S's? He's a stabilizer, but he's all these things. But you can start to identify that in your patients, and then you can change the conversation. So
that is cool. Well, purely from a outside looking in, I could spend literally days. There's so many different things that I could talk to. I really appreciate you taking the time. If you were to, for our listeners, for the viewers, for the folks who are looking at this, if you were to kind of sum up, or I don't know if it's possible, because we bounce around all over the place, what we've been talking about here, what's kind of the message you'd like to get out, starting with the hygienist, but also the other members of the team, the dentists, and even the patients? What's the message you'd like to get to them from utilizing this forum?
Sure. I think that there's a lot of grace that needs to be given to everyone, and the opportunity to be heard on both sides, and respectfully, but for that follower to step up and ask for what they need, give ideas, ask about where you are in the process. How are we getting ahead of this? How are we going to remain employed during certain aspects of this? That openness, that vulnerability that has to occur between the teammates, and that encouragement also. between teammates as well to say, we've got this. How can I support you? And then, work on your communication. If something is really it's what people don't say, right?
Yeah.
That you pick up on. It's not always what people say. So what are they not saying that you can pick up on, and ask those questions and say, I notice things aren't different, but come to them with compassion. And then also give people opportunity to offer advice to you and be open there, because we're all going through a disruption, and that disruption is room for growth in all of us. And we all have room to grow.
That is cool. Thank you. Thank you so much for that. That is, wow.
I know you and I could talk all day.
Yeah, oh, totally, totally. First of all, I want to thank you for joining us. I also want to highlight, God bless. Ready? Do you know this man?
Oh, Dr. Hyman, thank you. Oh.
Well, yeah.
He's the guy. It's the guy saying that about me. Oh, I love you, Dr. Hyman. Thank you. He's such a great supporter. What a
wonderful friend, and he's been an incredible person and all that. I would love to spend more time, but if people wanted to get information or wanted to contact you or learn more from you or even engage you, what would be the best way to do that?
Sure. Thank you for asking that. I have a website that you can go to. It's got all my contact information, but it also has courses that you can take. You click on them. They're already pre-recorded courses. It's about how to incentivize dental hygiene care, how to be a follower, how to be an active follower. And that is nextleveldentalhygiene.com. So nextleveldentalhygiene.com. And then also it's Kelly at nextleveldentalhygiene.com is my email address. Thank you for that.
Awesome. Fantastic. So months from now, as we're getting more into this, as we learn more and all that, would you be open to joining me and us again, and so I can, kind of pick your brain about other things that we've learned? And then
I would love that.
Really?
I would love that. Are you kidding me? Come on.
Well, thank you so much. And thank you for taking the time, and there's so many things, and you're right. And, hey, folks, those of you who are listening, Dr. Kelly Tanner, what an incredible resource. What a wonderful perspective. It's about communication. It's about having the courage to be open, vulnerable. I took that away from this very strongly. Having the ability to just not feel that you can't. Very important for me is being a leader is also being a follower, and followership. I love the context of that. I really hadn't heard about that. And it's right, because if people don't follow, you're not a leader. And if you can't follow, people won't follow you. So
we all started off as followers. And how do we get there? We had the courage.
Awesome. Well, thank you so much. Please be safe. And those of you who watch it, if you like it, please share. If you have any questions for us, or if you'd like to contact Dr. Kelly, please do that. Have a great rest of your week. Please stay safe, and I look forward to getting to know and spend more time with you.
No, likewise. Thank you so much.
Appreciate it. Thanks, everyone.
All right. Have a great day, everyone.